First, talk about national debt. Many Americans are well aware that today we owe well over $15 trillion in national debt. This year alone, we're going to borrow $1.3 trillion on top of $1 trillion last year and the year before that. There are trillion-dollar deficits as far as the eye can see. And last year, the House Republicans put forward a budget that showed a path to balance, telling the American people how we balance the American budget at some point in the future. Now, last year and this year, the president put out a budget, neither of which ever balanced, never telling the American people what his plan is to bring American spending to balance with its revenues. And so we look a couple years back when the president in this House passed the Affordable Care Act, or Obamacare, which the CBO now states that over 10 years, the rosiest of projections say it's going to cost the country nearly $2 trillion more. Even when they put out that budget, or that proposal for health care reform, they're still not willing to put out a budget that says how we're going to pay for it. That concerns me. I'm a father of 6. We're spending today and passing the bill off to the next generation. It's unconscionable. Let's actually talk about what the president and this House has passed in Obamacare. $2 trillion over 10 years in additional spending. It's a bill that is going to power bureaucrats in this town to make health care decisions for Americans in every part of the country, instead of your family, your health care provider, or you making that decision. And listen, I'm from Wisconsin, and I know that the values that we have in central Wisconsin, they're probably a little bit different than Arkansas, or Kansas, or Kentucky, Minnesota, or Michigan. And I think we should allow people to make their health care decisions instead of bureaucrats in Washington. But what concerns me the most is how Obamacare impacts Medicare. Now listen, Obamacare takes $500 billion out of Medicare and uses it to fund Obamacare. And now we all know in America that we have some financial pressures on Medicare. And we know that we have to come together as a country, as a community, both parties, to figure out how we're going to pay for Medicare, keep the promise to our seniors. And at a time when we're still having that debate, to think that this House would pass a bill and take $500 billion out of Medicare and use it for Obamacare, I think that's wrong. Let's first figure out how we keep the promise to our seniors before you make a promise to anyone else with their money. That's unconscionable. What concerns me the most is what the gentleman from Arkansas mentioned, which is the Independent Payment Advisory Board. It's the IPAB board, and we haven't heard a lot about it, but I think you'll hear a lot more as the months go on. This is a board of 15 unelected bureaucrats. And what they're going to do is look at reimbursement rates with Medicare, and they're going to be able to systematically reduce reimbursements to doctors, hospitals, and clinics for the care for our seniors. And let's make no mistake, this is reimbursements for our current seniors, not for some future generation. It's for today's seniors. And the argument by the president goes like this: Mr. and Mrs. Senior, don't you worry about your quality of care or your access to care. We're just going to pay your doctor, your hospital, and your clinic less for your care. If you believe that, I've got oceanfront land for you in Arizona. Of course it's going to affect our seniors' access and quality of care. When you pay less for it, you're going to get less of it. And our seniors, they've worked a lifetime. They've bargained. They've retired based on this promise for Medicare. And this proposal doesn't meet that obligation. It takes $500 billion from Medicare, but then is going to ration the care of our current seniors. Seniors who can't go back into the workforce and get another job, they've retired based on their promise from the federal government, and Obamacare reduces that that bargain that's been made with our seniors.
Will the gentleman yield for a quick point?
Sure.
You know what really scares me is that this restricted access to health care, to Medicare that you're talking about, it already exists. The IPAB, the Independent Payment Advisory Board, that's in Obamacare, that will cut the amount of reimbursement to doctors when it gets going. It's not even cutting yet, and we already have a problem with seniors getting the doctor that they want, because so many doctors have said, I'm just not going to take Medicare anymore. And I just wanted, before I yield back, I just wanted to mention an email that I got in my office this week. There was a constituent of mine, John Pollitt. He's the program administrator for the Arkansas Senior Medicare Patrol. He goes around and he talks with seniors about Medicare and how to recognize fraud in Medicare. And he was at the Sherwood Senior Center this week, in my district, and he was giving a presentation teaching Arkansas seniors about Medicare fraud. And a lady, a senior who's on Medicare, an angry senior, said to him, she wasn't angry at him, but she said with passion, quote, I don't understand why I'm forced to pay my Medicare premium but can't find a doctor who will take me because I'm on Medicare, end quote. So we already have a problem with access to Medicare because doctors, more and more doctors, are saying, I'm not going to take Medicare. And there are a host of reasons, the reimbursement rate, the administrative hassle, what have you. But IPAB, I hear the gentleman from Wisconsin saying, the Independent Payment Advisory Board that's in Obamacare is only going to make the problem worse. Because while some of us are interested in reforming the way Medicare works so that we get more service for our dollar, the president is only interested in saving money by just reducing and cutting without reforming. We all understand the need to reach solvency. But those of us who back Medicare reform want to do it through innovative, creative, cost-saving approaches that avoid rationing. Whereas the president simply wants to cut through an unelected board. I want to yield back now to the gentleman from Wisconsin. I just thought it would be helpful to give you a real-life example of a senior in my district who's been impacted by that.
And I appreciate the gentleman for telling that compelling story. All of us have stories like that from people in our districts, from our own family members, our friends, our constituents. And this is a very important issue. And that's why I think we have to have this conversation about what the Independent Payment Advisory Board will do. And I was a former prosecutor, and we're used to a system where if you don't like the decision of a court, oftentimes you're able to appeal that decision. This board is unappealable. The decisions that they make, the 15 members, when they make a decision, that is going to be the law, that is going to be the rule, and you can't appeal it, and you can't have it overturned. And so I just want to close my comments up on the Independent Payment Advisory Board. We don't believe on the Republican House side that we should go forward with a plan that was going to systematically reduce reimbursements for seniors, that's going to affect the quality and access to care for our seniors. Let's give them what they bargained for. We in the House Republican side, we said, put back the $500 billion. Put that back into Medicare. Do away with the IPAB board. If you're going to make changes to Medicare, make it for a future generation, a generation that isn't near their retirement, a generation that will have enough time to plan for the changes in Medicare. But don't pull the rug out from our seniors who've been given a promise and now aren't going to get it because their Medicare is going to be rationed. We think it's fair to do it for a future generation. But let's make no mistake. When we hear that one party has transformed Medicare or changed Medicare as we know it, there is one party who has done that, and that's the Democrat Party in Obamacare. They have changed the way that Medicare is going to work. They are going to ration it. We believe we should save it, protect it, preserve it, and I know my freshman colleagues in this House are going to fight tooth and nail to make sure that every one of our seniors get exactly what they bargained for in Medicare, and if there are changes, it's going to be for a generation that can plan for the change in Medicare in due time and due course. With that, I yield back to the gentleman from Arkansas.
I thank the gentleman for joining us here on the floor tonight. I see my friend, Mr. Quayle from Arizona, here with us on the floor.